I'm Catherine Pollard. I'm from Monitor, which is the economic regulator for the NHS in England. And my job there is to do two things. The first is to think about how we change the way that we pay providers of healthcare services in order to deliver care that's more efficient and more person-centred. And the second is to be Monitor's policy lead for integrated care. So that means integrated care is a big part of my role, because in the NHS in England we see that delivering more person-centred coordinated care is going to be crucial to meeting the financial and quality challenges that the NHS faces at the moment. So I think the challenges fall into two distinct categories. The first category are some of the national challenges around the way that we regulate the providers and the payers of healthcare services, and the way that we train doctors. It's very much still all predicated on a kind of a very medical model of delivering healthcare services, one that waits for people to get sick and then tries to treat them efficiently when they do get sick. Whereas when you think about an ageing population where actually they've got quite a range of complex needs, including mental health needs and maybe social needs in terms of feeling isolated, actually what you need is a proactive model of care that is much more focused on the whole person and the goals that they want to achieve, and wraps care around them. And I think that national bodies will over time need to evolve their regulation in order to support that way of delivering services. But in the meantime, we're actually encouraging lots of local sites to experiment with new ways of working. We're calling them new care models, and they're built very similar to the way that the accountable care organisations have been established in the US. And my team spend most of their time trying to help maybe between 20 and 30 places in England, covering populations of 50 to 150,000 people, to experiment with developing these new care models, and they'll help us make better regulations in the future. So the conference here has been fascinating because it's really struck home to me, I think, two things. So the first is that the challenges are completely universal. So the issues around incentives and how you have a workforce that can deliver care in a way that's different from how they were trained, and actually that there's so much we can learn from each other because actually we're all tackling the same challenges. And the second thing that I think I would kind of observe from having listened to some of the speakers is actually that in England we beat ourselves up a lot about how maybe poorly we're doing, but I think there are some, compared to some countries, particularly some of the other European countries, I've been surprised that actually I think we've come across as being doing things that are quite innovative and that pursuing integrated care at a scale and pace that is bigger than what other countries have done. So that's actually left me feeling quite positive. And I think, you know, the final observation is actually that the people that I've met here have been so passionate, and it's really, really great to have found so many kindred spirits, even if we are spread across the world.